Hello and welcome to Klose Training. I'm Klose, the Executive Director. I appreciate this opportunity to tell you all about the power of lymphedema certification. What does it mean when I say the power of lymphedema certification? I strongly believe that lymphedema certification has the power to change lives. Not only the lives of your patients suffering from lymphedema, but also your professional lives. The feedback that we receive from our graduates is universally the same. They say that their lymphedema certification has been the most valuable continuing education training they received. Edema and lymphedema management is not well taught in medical school. We interviewed a few patients. Let's hear what they have to say about that.
Yes, so I was diagnosed in 2014, but really started seeking my first help when I was 13, so it'd be 29 years ago.
I had two cancer treatments, and the second one is when they took out a bunch of lymph nodes, and after that time I was starting to get minor swelling in the leg, and at that time nobody really knew what was causing us, I guess.
Going through my treatments after the chemo and the surgeries, they didn't really tell me about lymphedema.
And every time that we would go to the doctor would say, you know, exercise more, you've got heavy legs.
And the doctor was a new doctor, a very young doctor, and he knew exactly what it was. But unfortunately, he said, here's a diuretic and that's all you do.
Physicians want to go ahead and prescribe a strong diuretic such as that when they see swollen legs that are oftentimes attributed to congestive heart failure.
And they sent her away saying, well, you've got fat people legs. That was the doctor's exact words. And
I might have lymphedema, and I said I might have lipedema. I said, but you're the medical professional, so I said, I've just been doing research online trying to figure out what's going on with me.
I did all this research, I printed the articles, and I took them to my doctor. And when I first walked in, and I said, I'd really like to talk to you about lipedema, because that's sort of the direction I had gone with my research. And he said, you must mean lymphedema. And I said, no, lipedema. And he says, well, that doesn't even exist.
The terminology that was used, chronic lifelong illness, came from a physical therapist, not a medical doctor, not the surgeon, not the oncologist, a physical therapist.
They just kind of blew it off as insignificant, like it was really no problem, but it really is a problem. It's a daily problem we have to live with.
Mine is mild, and it still affects my quality of life to the point where I'm angry. And so that's why I've gotten involved in talking about this. And the strange thing is that many celebrities we know are suffering from this, but nobody wants to talk about it for some weird reason. So I thought, okay.
You're the woman.
I'm the one.
In 29 years with the prescribing of the diuretics and everything else, rarely did a doctor look at my legs.
they need to be either taught the basics of what lymphedema is or a thyroid condition, and if not, send you to the right person. Just don't shrug your shoulders and walk away.
Shouldn't I be seeing someone as a follow-up? You know, like I've got primary lymphedema as a diagnosis. It seems like I should be following up with someone. Like if I had heart issues, I'd go to a heart doctor. I have primary lymphedema, and there really isn't anyone that I can go to, and that drives me crazy, actually.
Now you may ask yourself, what does it have to do with my profession? Fact is that these very patients are referred to physical therapy or occupational therapy services for an evaluation and treatment. And these patients rely on your expertise. They rely on you to be that resident expert to manage their edema and/or lymphedema. I would like to give you two patient examples. One is of a recent patient who received physical therapy specifically for the management of his bilateral lower extremity lymphedema for over a decade without success. It wasn't until this patient was referred to a certified lymphedema therapist who then initiated proper lymphedema therapy, which included manual lymph drainage and bandaging, that this patient's edema responded rather quickly. This is a patient on intake. Remember, he had already been in therapy for about 12 years. And here's a patient 3 weeks after initiation of proper lymphedema therapy. The changes are not only remarkable in terms of size, but his skin integrity has vastly improved, and the overall health of his tissues is much better. And he continues to make great progress. Now his wife is asking, rightfully so, why this treatment wasn't offered to her husband much earlier. I hope you agree that it is inexcusable that patients like this one don't receive the treatment they deserve from the time of diagnosis. Here's another example how lymphedema therapy certification benefited a patient with upper extremity breast cancer related lymphedema. Let's take a look at Ed's story.
We were in Texas visiting our children for Thanksgiving and the holidays, and his arm and his hand just swelled up.
My arm had swollen to almost twice the size.
And it was very concerning because we had no idea what was going on and what the problem could be.
Neither my wife nor I knew anything about lymphedema, and not knowing what it was, we were told to go to the emergency room with a possible blood clot.
A trip to an ER eased our nerves because we knew then it was not a blood clot, and they informed us it was lymphedema, which was a result of his breast cancer and his lymph nodes being removed.
The ER doctor had told me that there was a simple way to get rid of it, which was in air.
They simply told us to wrap his arm and to massage it. Well, of course, that didn't work.
The procedure that I really needed, we didn't learn until after we got back to Colorado. And fortunately, the therapist I got had been trained through the Klose Training, and she immediately, when she saw how bad I was, began doing the massage and moving the fluid through the body and then finally into the arm. And it just took a lot of work on her part and with my wife helping to get myself under control.
Being directed to Klose Training has been a lifesaver. It has made it more livable because we know what to do, and it is working for him and making his life and mine more comfortable than knowing that there is something that can be done that will help.
In our certification training, you will acquire the necessary therapy skills to treat lymphedema. But you will also learn how manual lymph drainage and compression assists you in the treatment of your orthopedic patients and patients with post-traumatic and post-surgical swelling. I hope this explains the benefits of lymphedema certification, and I invite you to watch Stephanie's story, Living with Lymphedema, here on our homepage to witness firsthand the power of lymphedema certification.